Thanks for having me today. Adam Dreher, Polk County IT. Here representing the Climate Action Team, specifically the Fleet and Fuel Subcommittee inside of Climate Action, talking about the Polk County EV and charging plans into the future. So I'll be just going over high level, what is an EV, what is charging, just to make sure we're all on the same page, and then go over the Polk County plans and the Polk County, Polk County reduction of greenhouse gas emissions plan to 2040. So first of all, let's talk about, when we talk about EVs, how is an EV defined? What are the trends in the automotive market? And when we talk about charging, generally speaking. So an EV can really be one of three models. The straight EV, which is you plug it in and it only has a battery. Hybrids, where it has a battery but it also has a gas engine in it. And then a plug-in hybrid, where it primarily runs on the battery initially, and then it has a gas engine as a backup. So there's three different market shares to talk about. Generally speaking, the market for these EVs is increasing, and you can see over time since 2014, we're up to a 21% market share for hybrid electric and plug-in vehicles generally. And that's gonna continue to increase. Projections, even with some of the changes in the federal level, projections still have the EV market share increasing across all three stripes. And increasingly, there are more and more manufacturers investing in pure EVs instead of just the hybrid models. And you can see on the right the breakdown of the difference between hybrids, electrics, and plug-in hybrids. As far as the EV cost of ownership, this slide is a little bit up in flux, and we'll talk a little more about the 2025 reconciliation bill as well as some of the tariff environments. So some of these numbers are a best guess as of about a month ago. Some of that's changed probably, but even absent any kind of credits, typically they're about $2,800 more for an equivalently priced internal combustion engine. Overall, however, they do have low overall maintenance costs are much lower. You don't have oil changes, you don't have moving parts inside the engine. The recharge refuel costs, you're talking about a half or a third of the price of gasoline for charging. And it really depends on the price of gas, the price of energy. Lifetime savings can range between $7,000 and $14,000 per vehicle, and then these numbers are continuing to shift toward EVs, or they were until about a month ago. Again, some of this will be come out in the wash to figure out what does it look like into the future, changing environment. The charging environment for EVs is a little complicated, so I'll spend just a couple minutes talking about what does it mean to charge an EV. So there are three tiers of charging, level 1, 2, and 3. Level 3 is the big boys. This is off the side of the interstates, super fast charging, DC charging. We're not going to talk about that here at all. That's super high investments of dollars and really meant for replacements for true gas stations. So that's really off the table. Level 1 charging is you plug it into a 120 volt outlet. It takes, if you got a 0% charge to 100, it'd take you 3 days, 4 days to charge an EV at that level. So the sweet spot for Polk County is the level 2 charging. That's a 240 volt outlet. And really, that's where you see the charge point chargers. If you see around town, the charge point chargers with the 2 head units, those are the level 2 chargers with the higher amperage. You can go from a 0% charge to a full charge in under 6 hours. So overnight charging for a full charge, or if you're just topping up, I'll park my vehicle in the ramp next door. I'll go from 70 to 100 in less than a few hours. So that is really what we're looking at, is that level 2 charging for Polk County usage. Level 1 is too slow, level 3 is too expensive, and has too much infrastructure involved. So we're looking at that level 2 charging, generally speaking.
Adam, what is, because I have a level 2 charger at home. That was a Tesla charger. It cost me maybe, I don't know, $1,500. And then what is the cost on a level 3 charger?
Level 3 chargers you'd be talking about. So the thing you see when you go to the level 3 charger is like the Tesla charging stations.
Yeah.
That's really just the head unit. Those are, you can have as many of those as you want in a given location for minimal additional costs. The real meat and potatoes is the generator that's hiding somewhere on that same location, and those are upwards of $100,000.
Okay.
So it's a significant investment in that the DC converter unit that can get you up to that 1,000 volts to get super fast charging in place. If we ever get to the point, or when we get to the point of talking to the sheriff about pursuit vehicles in EVs, that's when we may need to think about, okay, what does it look like for Polk County to talk about level 3 charging, if we're going to look at pursuit vehicles potentially.
Okay.
That's further into the future and not a current major concern.
Okay.
So why is Polk County talking about EVs generally? Back in 2021, we set a climate action team mandate of reducing our greenhouse gas emissions by 90% by 2040. And there are goalposts set along the way for 2030 and 2040. So by 2030, the goal is to reduce our greenhouse gas emissions by about 1,000 megatons, metric tons, and have about a 20% EV share in our fleet. So we're talking of all of our fleet vehicles, by 2030, we're targeting 20% being EVs of some variety. That would then reduce our overall gas consumption and reduce our overall carbon footprint and our greenhouse gas emissions. By 2040, you can see for our standard fleet, that's light duty, standard duty vehicles, we'd want to be at 100% EV share. That's obviously a long-term goal, but it is a significant investment to get there.
So how many do we currently have in our fleet?
We have, for general services, we have 6 vehicles located at 70 College that the general service use. It's mostly vans. There's a couple light, small vehicles.
Okay.
And then there are 12 EVs split between EVs, plug-in hybrids, and hybrid vehicles at conservation.
Okay.
So conservation has a separate effort for these electric vehicles versus Polk County proper. Ken Young is here to correct me wherever I go astray with the conservation conversation. But the goal is to continue to expand these vehicles to other departments outside of just general services.
So Adam, are we keeping a log of the longevity and issues of the vehicles to see the reliability that they are for our fleet, or?
Yeah, all of those 6 vehicles are newly purchased, but any vehicles will be tracked in our standard fleet tracking mechanics. So any EV or ICE vehicle will be tracked for maintenance and repairs just like any other vehicle we purchase. And then those vehicles are graded, and that's actually how we arrived at a general list of what vehicles to replace. Is we have a grading system that says this vehicle is 15 years old and it has 100,000 miles. It's graded as a replace it right now. That same grading mechanic would be applied to the EVs as well.
And is our life cycle somewhere between 5 and 7 years for replacement of those vehicles?
Most likely, the EVs will have a slightly longer replacement cycle. The limiting factor is the batteries. And then really some of that battery longevity is still an open question in some cases. So I think we'll see as it bears out in the market generally. But with the lack of moving parts of an ICE engine, then I would say you expect a longer lifespan for an EV than you would for an internal combustion engine, expecting the battery retains its charge effectively. So I would say you're closer to a 10-year than a 7-year lifespan for these EVs.
Does Public Works and somewhere else, I think, have the infrastructure in place to do those EVs?
The charging?
Yeah.
So General Services has, at 70 College, has some inverters set up to facilitate the charging of the 6 vehicles they have. That's the only current footprint we have for the charging. Outside of conservation has charging units for both fleet and public access at a variety of locations, trailheads, lodges, at the nature center. But as far as Polk County proper, we really just have the level 2 chargers at the College Avenue location at this point. So we worked with Ryan Ward as well as Scott Orth to talk about what does replacement look like for our fleet, right? We're following standard fleet replacement and then talking to the departments and leadership to say, are you willing or interested in an electric vehicle when talking about replacing this vehicle or that vehicle? So I had some conversations with the department leadership to gauge interest, and there was a good amount of interest, especially from the health department. Jillian was very interested in replacing her vehicles with electric vehicles, as well as, and obviously in general services, public works. There was a good amount of interest. But the most common question we got in this, outside of how long will the battery last, which is, depends on the vehicle, depends on the weather, was how do I charge it, which is why I'm here, right? I think we are in a situation where it's a chicken and the egg, right? If we're gonna purchase EVs, that's a really great idea and it matches our long-term goals, but we need to have the infrastructure in place to charge those EVs if they're parked at Polk County buildings overnight. So that is really what brought us here was, let's talk about that EV infrastructure and the investment in that EV infrastructure for Polk County. So departments provided interest, concerns, or questions, and then we have that preliminary list of vehicles to replace with EVs, and we've got that list running at this point. supply is more readily available than it had been previously. There are a lot more EVs on the market and a lot more availability to purchase those EVs, which is nice. We have a little more choice available to us. So here's where we get into, again, that level 2 charging. I have the charge point units up here on the screen. We do have some quotes from a company called Carbon Day. They are on a state contract and they can provide these charge point units through that state contract. They run, just for the charging units on their own, depending on the level, right? But that mid-level that I was targeting is about $7,200 for a charging unit that has 2 plugins. But you can charge 2 vehicles off of a $7,200 unit. Scott I talked to Scott Orth, and his team can definitely install these units. Carbon Day can provide training and expertise to our master electricians. So we can do the boring, we can do the electrical install, and make sure that these things are maintained internally to reduce long-term costs for these units. These units also, the newer charge point units come with the dual head units on them, because I know you have a Tesla, but if a non-Tesla vehicle in North America has a different charging head on it. The new charge point stands have both charging units on them, so you can use either a Tesla or a non-Tesla at the same station without an adapter. So we're looking at the newer model that has both versions on it, so we can purchase really any type of electric vehicle and charge it at that station. We then also talked about where do we roll these out to. Again, that's matching it against department interest, against where do we install these initially. So the initial thought was health department over at Carpenter, 1900 Carpenter, as well as here at the admin building, and then over at 70 College would be the 3 primary initial locations for install of these charging units. Carpenter is a really good idea because it's somewhat of a charging desert. You can run maps and see where charging units are across the metro. There are none anywhere near Carpenter. So we would provide, if we were to make it available to the public, as well as our fleet access, we'd be providing a charging station where there are no other charging stations nearby for the metro in that area. College really would be a fleet charger behind the garage for our internal vehicles. And then here at the admin building, again, I would advocate 2 different stations, one in the basement for public work, for general services to plug into, and then one or another couple units out in the parking lot for a mixed public and fleet usage where either we could charge or the public could charge in those locations. When it comes to the public access, we have a lot of decisions we can make of how much do we charge? Do we make a profit off of it? Are we just covering our electric costs? Those are conversations that can happen into the future. This slide was a new one I just added, unfortunately. With the 2025 reconciliation bill, the $7,500 tax credit for electric vehicles is being phased out effective September 30th. So that will cause these electric vehicles to cost approximately $7,500 more per vehicle, assuming they were meeting the guidelines previously to get the full credit. And that's depending on the vehicle, there's a different level of credit, but generally speaking, an EV built by an American manufacturer could get most of that $7,500 credit until September 30th. Additionally, as Mark was saying, there was a significant investment in the charging infrastructure to have stations installed and providing grant money to install stations across the country. And they started on the coasts last year, and then that program has been put on hiatus at this point. So I don't anticipate any further dollars coming to help fund these charging stations. I was hoping to come with better news that we'd have some support on that, but I don't anticipate further support in getting these level 2 chargers installed across Polk County at this point. And then the final piece is we're not really sure the costs of these vehicles, what they will look like into the future. Most American-made, quote-unquote, vehicles, so taking Ford, Chevy, et cetera, those components are sourced from a variety of countries, including Mexico, Canada, China, Germany. So depending on where those components are sourced, they may be subject to tariffs, it's unclear. And then most of these vehicles are assembled in Mexico. So their components are shipped to Mexico and assembled south of the border and then shipped north. Again, it's unclear what that will look like into the future. So there could be some significant cost increases. Neither Ford nor Chevy have really talked about what they're going to do about those costs at this point. So I can't answer that question at this point. I would anticipate significant increases in overall costs, however, for any replacement vehicles, either for EVs or standard internal combustion, as a lot of those components do come from overseas.
So basically going back to your slide of where we want to be by 2030 on our 90% reduction in our carbon footprint, how do we anticipate that looking as a fleet in 2030, and what type of commitment will we need to make towards that in terms of electrification of our vehicle fleet?
So for the 2030 goal, I'm excluding essentially all of the sheriff's office. That's a longer-term discussion about pursuit vehicles and detective vehicles. So really, we're focusing on the light-duty vehicles for things like the health department, public works, general services, some of those light-duty trucks and cars that we can transfer into service. So I think we have a large choice of what we can replace.
Okay.
It's just a matter of finding the right fit for the right role and finding the right vehicle for the right role.
Okay.
So the cost associated with that replacement will be slightly higher than typical cost would be just to replace a standard internal combustion with another internal combustion, but not drastically higher. And then over the lifetime of the vehicles, I would anticipate that return on investment making up for that cost difference.
So we're talking about a fairly modest investment in charging stations at Carpenter and at Polk County 111 Court. Anywhere else that?
College, the garage over at College to charge the general services
I thought
vehicles.
they already had them.
After talking to Scott, they're using some off-the-shelf
Oh,
items.
okay.
The advantage of the charge point units, especially the fleet ones, is you can track your energy consumption,
Yep.
and then you can report back on that. Right now, that tracking and reporting is extremely difficult, so we can't really track exactly how that energy is being consumed or being distributed.
Okay,
So I think it's worth of an investment there to speed the charging, as well as be able to track the charging more accurately to the vehicles associated with those chargers.
okay.
Adam, has there been any consideration on the plan you guys laid out when the world looked a little bit different, to revising our schedule and do something that still tries to move towards energy independence, but the timelines are adjusted?
So we haven't had that conversation yet, and this is a delicate balance I've been trying to strike with the climate action team. The climate action team mandate really has no commentary on price, right? There's no costs that are associated with the climate action team mandate. However, I am fully cognizant that we have to be considerate of that. So everything I've done to now, including the solar panels and any EVs conversations, has been with an eye toward long-term return on investment, making sure that anything we're going to do either saves us money in the long term or costs less, or is cost neutral. So at this point, I still believe we can do the 2040 goals while being revenue neutral. It is going to be harder, and there's going to be some harder decisions, but I don't know that we have to change those 2040 goals at this point, unless we're going to say we have to be revenue neutral, where we save money no matter what. I think we can still hit those 2040 goals at this point without a huge change to our overarching plan.
And are you prioritizing your charging stations as far as, the chairman named off 3 spots, or mentioned the 3 spots you got? I mean, I think the first importance here is invest in Polk County.
Mm-hmm.
So that would be what, Carpenter and College, and then downstairs, and then eventually, we're not trying to provide a service to the public. We're trying to provide a service we are, but through energy reduction of our employees, less gas and all that. So prioritizing what's going to be first, because financially it's going to come to us.
Right.
And we're going to have to make those. So if you can prioritize what you want, that'll help us figure out what we want to do and what we can invest in.
Absolutely, and I think that's the reason for those initial 3 locations, is it gives you the option. You can choose to make it fleet-only chargers very easily, or you could choose to open it to the public if you chose. These charge point units let you flip a switch, and you can make it so that only internal users can access them and plug in, or we can activate it and make it so it's publicly available. And then again, the amount we charge can simply be cover the cost of the energy, or have a small return on that investment to pay for the actual unit itself.
Okay, thank you. That was going to be my next question, because in my prior role, we had the conversations about putting in chargers, and we were going to charge the public for them or not. So, and that fell apart, and we didn't do it because there was disagreement on it.
There are some state of Iowa laws around the taxation of energy provided if it's going to the public. So if we do make it available to the public, we have to make sure we take into account the tax associated with that charging. So basically, we owe the state X percentage of the charging if we make it available to the public. So you'd have to just increase your costs to the charging consumer to cover that tax as well to the state of Iowa. So that's a consideration. My recommendation at this point would be start with fleet only, and looking at making sure we can charge our vehicles, and then we can look at availability and say, okay, well, we're not plugged in 24/7, so let's open up the charging stations to the public during these hours when it's typically available and we don't have employees plugged in at that point with their employee vehicles. The last part I want to touch on was there are some questions around at-home vehicles. So a large number of our county vehicles are taken home by employees. There are some compliance and HR concerns as well as union concerns around that. So we're avoiding any vehicles that would be taken home by employees. So we don't have to worry about yet figuring out what does it look like to charge a vehicle at an employee's home. There are some liability concerns as well as cost concerns, and what happens if the employee separates service, what happens to that charging unit at that point. I was working with Josie prior to her departure to figure that out, and we'll continue to work toward a long-term solution because it will be a problem we need to address at some point, but I'm trying to defer that problem, similar to deferring the sheriff's office problems to the future. I'm trying to focus on the easy wins right now for these EVs and reducing the overall carbon footprint for now on those.
So as I understand it, our first priority would be to replace the chargers at Carpenter.
The chargers at college, so that's an easy win because it's behind the garage and we already have our general staff there that can run the power in place. So that's an easy win, and we can do a dry run there. My secondary location would be this building because we have a lot of vehicles in and out, so we can charge here. And then once we kind of just decide with the health department, which EVs do you want to pursue and purchase those, that would be the third step, would be that Carpenter location so that the health department could charge those new EVs that we're looking at for them.
That would be outside too, so.
It would be. I think, again, we would just set those to be fleet only initially until we can make a decision long-term about what does it look like for public access.
How many cars would they have?
I think the replacement for the health department was 3. I don't have that in front of me, but I believe it was 3 health department vehicles that were eligible for replacement that were well suited to EVs given their usage patterns. So I was 2 head units, the ability to charge 4 vehicles.
Right.
And then again, you can grow those. Once you've bored the pipe, if you need to run more wires to install more units, that's not difficult. So that would be, you start with 2 units at the Carpenter location, and then you can expand if needed from there. Similar to college, so because it's inside, we'll start smallish, probably 2 or 3 head units, and then expand as needed.
Have we done like an energy assessment on the ability to expand the capacity out there? I mean, does the infrastructure exist to add?
Yeah, I talked with Scott Orth a bit, and we believe that all 3 of these buildings do have the capacity to support these charging units. Again, they're 240 volt. It's like installing a dryer, so it's not a huge lift as far as the panels are concerned. We would do another assessment once we decide to move forward or not with those charging stations, but at initial assessment, yes, all 3 locations can support the additional needs of these stations. Additionally, in this building, because we have panels on top of the building, some of that charging would be offset by some of the generation of the solar panels as well, which is a win-win to utilize some of that extra power we're generating on the roof.
Adam, I wanted to thank you again for you and the work of your team and moving us forward on the energy, our stretch goals.
Yeah.
And, what we don't know about EV charging and the cost of these units and the challenges ahead in the EV market, we don't have a crystal ball to see where we're going to be with tariffs and everything else. But I think as long as we start putting numbers to paper and in the future looking at the cost of the conversion of the fleet and kind of a benchmark for how we're moving towards that 2030 goal and then how we're moving towards the we need to meet our environmental goals, but it also has to make economic sense, right?
Right.
So I think I think that will be helpful to us as these issues define themselves with the tariffs and with the direction, because those vehicle manufacturers are gonna have to figure out how to offset that $7,500 tax credit, which means they're gonna have to build less expensive cars
Right.
in the future, and they've figured that out already in China. That's the direction they're going.
Right, and I agree, there are some new models, like there's a frame truck coming out that's
Yeah.
technically produced by Bezos and Amazon, but it's a no-frills EV. It literally doesn't even have a radio in it. It's just a truck bed with a battery and some wheels.
Yeah.
So I think there is a recognition in the market that they need to find less expensive ways to produce these. Not every EV needs to be a premium model.
Right.
So I think the market's recognized that. Now it's a matter of which manufacturers can pivot to produce that.
Ford is losing $10,000 on every F-150 that they complete.
Right. Yeah.
That is not sustainable, so.
Right.
So, yeah, we appreciate your efforts and appreciate this conversation, and I'm sure we're gonna be back looking at this again in the future.
So I'll be putting together numbers and send it to Frank and you just to see what preliminary investment would look like for charging stations at the 3 locations we talked about in preparation for a potential EV switchover. So I'll get that out in the next week or two.
That'd be great.
Thank you.
Thank you.
Thank you, Adam. Sure. Yes.
Come up front.
Don, come on up and use the microphone there. I know you're not afraid of that microphone.
Especially lately. Don Chiano, I'm president of the ASME Local 68. I worked for 29 years out at juvenile detention. So the reason I'm asking this is that's kind of my home base, you know, kind of protective. I haven't been involved in this stuff, so I don't know where Eric has been involved in this stuff. Obviously he has been, but I don't know what he said. And the reason it kind of hit me was when we talked about how many vehicles the health department stuff has. They were talking 2-3 vehicles. Well, out of detention, we have generally 5 vehicles that we have out there. One of them doesn't get used hardly at all. It was the old food one that we kind of went back and forth between when we had shelter and stuff like that. We've always kind of maintained that vehicle. But we have 4 other vehicles. 2 of them are transport for court, or if we're shipping kids out of county. So one of those vehicles at least gets used almost every day, multiple times a day. They just bought a new minivan, but that vehicle now, because now we're going to court, less than I knew, they're going to court all the time. They're doing more in-person courts than what they were like during COVID, where we were doing video. So that vehicle gets used all the time. But even more importantly, we've got 2 other vehicles. So we have the tracking program, the impact program. Those people are in those cars at minimum twice a day, going all over the county, going and checking kids, depending on how many kids. But I think last I knew, the impact program can go up to 20 kids. And we might go from one county, one side of the county to the other side of the county. And we might go north, south, east, west some days. It kind of depends on where we have our kids. But those vehicles, and Scott might be able to attest to this, I mean, those vehicles get a lot of mileage put on them. And after a few years, and they're Ford Escapes, last I knew, every few years or so, they're looking at trading those off and getting back, because they just, mileage just through the roof on those 2. Those are probably the 2 main ones. But like I said, we've got the one that just goes back and forth to court, but then when we need gas, we have to go clear out to East 14th. Granted, it's not that far, but you still have to go clear out there to make sure you've got gas. Same way with the other vehicles, where if we had the charging station right there, because we have 4 parking spots that are attributed to them, it'd be easy to put stations there to do that.
Sure.
Obviously, we're always gonna have to have probably an internal combustion, because like we got a lot of kids sometimes sitting up in Sioux City. That's a long drive.
Right.
And then it's hard to stop when you have kids in the vehicle. You go up and you come back because it's a security issue and stuff. So, but if we're talking about amount of vehicles and if we're kind of saying the same, I just kind of wanted to make sure that you guys kind of knew, because I know a lot about that because I spent a lot of years doing that. That I think it's important.
Yeah,
Whatever kind of consideration either has or hasn't been done. I just want to kind of throw that out there because I think that would be, wherever we go with this, that would be an important consideration, namely because of that tracking program that we're doing.
I'm going to ask, just on that point, Adam and Scott to evaluate the juvenile detention for fleet vehicles, and is this an application that we should be considering for electrification?
Yeah, I just, just wanted to throw that out there because it didn't give, but I know we're at the beginning of this. but
Sure.
It just time, in the 31 years I've been here, there's just been times where we kind of, and you and I've had this conversation,
Yeah.
we just kind of get left off to the
Right.
side. And I think it would be important because of the amount of time and mileage,
Those
wear and tear on
vehicles.
cars that we're
Yeah.
putting out there because of a couple of those programs that we run.
We'll
I think would be an
evaluate that
investment.
application, Don.
That's all.
Yeah, I did talk to Eric.
Yeah,
So
I
Eric-
figured you probably
So
did,
yeah,
but-
the only one that was eligible for replacement this cycle was the transport van that wasn't being used very much.
Yeah.
And so the other ones would be in the next cycle.
Yeah.
We'll talk about it that way.
Yeah, they just replaced, I know the van that I used to drive all the time, they just replaced it. We had that like 10, 11 years and stuff. And yeah, there's one old van that we don't use that much and stuff, but we do have enough vehicles and enough mileage, so. Thank you.
Thank you, Don. Our second item today is the Dental Connection mobile program, and we have with us Kathy Salisbury and her team of Carly and Courtney, and they're going to present to us. I had the opportunity recently to tour the new dental mobile unit, and it was really a great asset for our community, and I just wanted to share that with all of you and have them come in and talk about who they're serving and what Dental Connections is all about. So, Kathy, I don't know if you want to kick us off or...
Oh, yes, I'm the MC of this event.
Yes, okay.
Well, good morning.
Carly.
It is such a pleasure to be here this morning, to be able to tell you, as the Polk County Board of Supervisors, a little bit more about Dental Connections, our programs, and our lovely mobile dental unit, which is so important to the children in Polk County and beyond. My name is Kathy Salisbury, and I'm the Director of Development and Marketing. And we've had a great relationship with Polk County Board of Supervisors for several years, and we are very grateful for the support that you've given us, and we look forward to a continued relationship with you. So I have with me Carly Ross, who is our Executive Director, and Courtney Walterman, who is our Director of Outreach Programs. I always want to call her something else, but nothing bad, just a different title, Community Outreach. So I would like to first introduce Carly. She's going to give you a little overview of Dental Connections and what we do, how long we've been here, and then Courtney's going to give us a little overview of the Smile Squad and the mobile dental unit. So Carly?
All right, well, thank you, Kathy, and good morning. Nice to see you all this morning. We're going to start off with just a short 2-minute video, kind of giving you a little virtual tour of our mobile program, and then after we finish speaking this morning, we'll actually take you outside and let you walk through it, so.
Dental Connections is a nonprofit community health center founded in 1919, over 100 years ago. And our mission is to provide dental care access to an underserved population in our community and to help those individuals and families to overcome any barriers that they might experience when they're trying to access high quality and affordable dental care.
I'm Riley Chalawa. I'm a general dentist, and I am the dentist that works on the Smile Squad for Dental Connections. So on the mobile dental unit, we are providing, like say, a host of services, all the way from preventative care through restorative work. We go out to elementary schools all across the Des Moines area. We can take out primary teeth, we can do pulps and crowns. We can really provide almost all of the care you can provide in a traditional clinic setting. Like I say, be able to provide that care that no one else is able to provide. I mean, it's just, if you see a student that doesn't have any insurance, they don't have any other resources. So these patients come from very low income families, and say a lot of barriers to care, and if they don't have health care, if they don't have dental insurance, then even just an exam, even just x-rays, those preventative services are out of financial reach of their caregivers.
The Smile Squad program has made me more aware of just how much access issues there are to dentistry. Des Moines isn't a very big town in perspective to the United States, but it's amazing how many students suffer from decay and how many have treatment needs at such a young age that we see in the preschools and in the elementary schools.
So to be able to see students that have been in our program year over year, and you see it working. You see that this student came in and they had a lot of problems that they go through. We restore them, we get them healthy, and now I get to see them just for preventative care. So we get to see them and we get to see that this program is working. Not only are we providing this care, are we getting these students stable, we're staying on top of it. We are their dental home, even though we're all over the place.
As she says, we are all over the place, and that is literally true. A mobile clinic on wheels, and we'll be able to take a tour here in just a few minutes. But first, I want to share just a few statistics about Polk County. Well, just generally speaking, this one always I find just shocking, is that cavities are the most common chronic disease worldwide. And in children, they affect more kids than asthma, diabetes, and obesity combined. We know that by age 8, over half of children will have at least one cavity, and that low-income children have 5 times more untreated cavities. And those are really the kiddos that we're trying to target through our programs. Here in Polk County, about 10% of residents live below the poverty line, and around 119,000 residents are enrolled in Medicaid, of which about 40% are kids. So we're talking tens of thousands of children here in Polk County alone who are struggling to access dental care. So Dental Connections has been around for a very long time, 106 years, and our mission is to provide equitable access to oral health care for all. And we really put the emphasis on all. So all children, all adults, any insurance type, any income level, any age. We'll go back a few times. So going back 106 years to 1919, the city of Des Moines was a bustling place. World War I had just ended, and the population of Des Moines more than doubled in just over a decade. The city was really struggling to address a fragmented healthcare system and all of the children and adults who were struggling to access care. And so around 13 organizations, including DMPS, the City Council, and the Dental Association came together to address this need, and Des Moines Health Center was born. So at that time, Des Moines Health Center, which is now Dental Connections, provided a whole host of services, including medical, dental, and vision care. We have been an agency of United Way since 1923, back when they are known as the Community Chest. We moved to our current location in the United Way building in 1987. Over the years, we have provided pediatric care, OBGYN, dermatology, family medicine. We've treated conditions like goiter, rickets, hypertension, chronically diseased tonsils, but you can probably guess what has always been the most highly diagnosed condition: cavities. So over time, we decided to focus our mission to exclusively providing dental care to our families. And we became Dental Connections in 2017. Same organization, new name. The need in the greater Des Moines area is great, especially now. We know that over half of kids ages 6 through 9 living in our state have had at least one cavity. For every child without medical insurance, there are at least 3 children without dental insurance. In the DMPS school district, over 3/4 of children qualify for free and reduced lunch. And we know that low-income children are less likely to have visited the dentist in early childhood, and yet oral health care is essential to child development. More stats on the need. We know that many Iowans face financial barriers to dental care. Many patients rely on state insurance, and it is a well-known fact that in the state of Iowa, there are not enough dentists who accept Medicaid insurance. So our goal at Dental Connections is to help our patients overcome any barriers that they might experience when they're trying to access high-quality, affordable dental care. And we do that through both our clinical and community-based programs. Our goal is to provide early intervention so that we can help to overcome any of sort of the systemic inequities that these children will face when they're trying to access care. So I'm just going to briefly talk about our main clinic, but our focus this morning is really the Smile Squad program, so I'll turn it over to Courtney here shortly. But our main clinic is located just about a mile or two up the road in the United Way building. It's a big clinic. We have 17 patient rooms, and we serve over 7,000 patients each year. We accept both children and adult patients from all over the world. We serve a large number of refugees and immigrants. And we also serve a lot of patients who are experiencing dental emergencies. As you know, emergency rooms are very limited in the care that they can provide if you're experiencing pain or swelling or need an extraction. So we see about 150 patients each month who are having dental emergencies. All right, with that, I'll turn it over to Courtney.
Alrighty, good morning. I am director of the mobile dental clinic and all things outside of clinic, so that's kind of my forte. The Smile Squad is most known for their mobile dental clinic. A lot of schools and families know about the mobile clinic, but they don't even know that we have a main clinic setting. So it's interesting to be able to have the new mobile with the branding to kind of tie the two together. We also have a fluoride varnish program that is in child care centers and preschools. Flashlight screenings and fluoride, and then dental screenings for the state-required kindergarten and 8th grade screenings in Des Moines Public Schools, as well as screenings prior to the mobile coming to visit each school, kind of giving families a heads up if your child has something that looks obvious or suspicious. I look in my child's mouth quite often. I don't think regular people do. It's very interesting. The Smile Squad this fiscal year has served over 9,000 students between the 3 programs. We are currently in 17 school districts and visit 61 schools with the mobile dental clinic alone. This year, we donated over $250,000 of dental care to uninsured students, and that's across all 3 programs. Our biggest school is Crestview in West Des Moines. It's grown considerably in the last even 3 years. This year, we had 90 students sign up for the mobile dental clinic. 76 of those students didn't have insurance due to Medicaid enrollment or immigration status. So 700 procedures were done in those 16 days. That averages to be about 8 procedures per student. So this isn't going in, getting your exam, x-rays, cleaning done. This is treatment of cavities every day for 16 days. We have a great relationship with Crestview. So we're able to go in and out of their school if we have free days within the schedule. Our new mobile arrived in Des Moines in September of 2024. My mom and I drove 12.5 hours in a day from Columbus, Ohio. She will never go on another girls' trip again, but she made it. She still talks to me. This year we're starting our rural expansion into 9 school districts. They average 60 to 90 miles away. Jefferson, Knoxville, Nevada, Greenfield are some that we're partnering with. They also have relationships with iSmile already, which is the state program. So we're partnering with iSmile to show that we are a community trying to serve the dental population and not step on anybody's toes. I forgot my gum. We also did a pop-up clinic at the health center in Fort Dodge and in Storm Lake. They have the same great population needs that we do, needing services. So we road tripped up there with the mobile and helped them out for a couple of days. This is Miguel. He is a 2nd grader at Garton Elementary, and he loves me, kind of, love-hate relationship, I guess. His teacher is a huge proponent of dental. She's been in the 2nd grade classroom for years. I've been in the 2nd grade classroom for years. So she had prepped her students that Courtney's coming in for dental screenings. So I walk in with my bag and Miguel just whoosh, Miss Courtney, that'll show you way too much. lifts his lip, shows me he has these two baby teeth. He has his adult teeth, two baby teeth, like pointing out. They gotta go. Okay, so I give my presentation, education, brushing, healthy foods, start flashlight screenings. He's right here. I was like, okay, I see him. Yeah, we'll send a permission slip home. So send the permission slip, get him ready. He sees me down the hall. Miss Courtney, now? Not now, Miguel. No, I'm not doing it. 2 weeks, 2 weeks. Every time he saw me, now. I'm like, no. He's completely embarrassed, doesn't smile because of his little teeth. So finally, 2 weeks later, the mobile dental clinic comes, and Miguel's teacher, the school nurse, everyone is, we've got to get these teeth out. So he goes out to the mobile, and of course, this now buddy is now, whoa, back up. You know, this looks like a terrible idea. So they do his exam, his x-rays, send him back into the classroom. School nurse calls. Miguel's back, he still has his teeth. Okay, so I'm at a different school. I call the mobile, it's like, Miguel still has his teeth? Yeah, he's not a good candidate. Oh, they're coming out. So after lunch, we'll bring Miguel back, we'll get those teeth out. Okay, so lunch happens in Des Moines Public Schools about 10:30. So 11 o'clock, Miguel hasn't gone back out. Noon, school keeps calling. Call the mobile, it's like, you guys, we gotta get these teeth out. I don't know. I was like, no, we're doing this. So finally, they bring Miguel out, last one of the day. There's 2 operatories in the mobile dental clinic, so sometimes you gotta be strategic on what you're doing with another friend on the other side so you don't ruin the experience for 2 people. So finally, they bring Miguel out, and they get the teeth out, and he's like, just walks in, flips his lip to everybody. He's a brand new man. So that's just one story. We do a lot of treatment on a lot of students. Miguel's is a feel-good story. There's plenty of stories where a student walks in with 4 quadrants of decay. We prioritize them. We can do half-mouth treatment. What seems aggressive to some people, doing 4 quadrants of dentistry in 4 days, is the only option for some of these students. Unfortunately, barriers keep them from coming to our main clinic. We have all their records. They're welcome in our main clinic anytime to finish their work. But a lot of families just can't get there, or between childcare and language barriers, they're not comfortable being seen. So we see a lot of students year after year on the mobile. We saw one at Urbandale Middle School, and she was so excited with the new mobile. She goes, I like what you've done with the place. It's like, this is brand new. We didn't just, this isn't new curtains. But students look forward to it. They know what to expect. They know that they're getting treatment that they wouldn't otherwise have right there at the comfort of their school. So it's fun to be out on the mobile. It's fun to be in the schools. I go to Edmonds a lot, and their kids all walk like this. So they want stickers, and they want to show me their teeth. So it's a pretty fun job. Questions I can answer for anyone? Or Carly or Kathy?
Do you have a slew of dentists that come and help?
So we have 8 dentists, 10 dentists in our main clinic. We do rotate. Dr. Riley Chalawa, who's our dental director, she is on twice a day. And then we rotate 2 others in and out of the mobile dental clinic. It's easier for students to have the same provider more than one day, so they know what the expectation is and feel comfortable with that provider. This fall and spring, we'll have both mobiles out, so we will have 3 dentists on regularly this school year. We have the same 2 dental assistants. One is Spanish speaking, which is very helpful, as you can imagine. So.
Great information.
Thank you.
I had no idea, so thank you for coming in today. I do have to know though, why was Miguel not a candidate? Why did they say, oh, he's not?
Why was he what?
You said, oh, he's not a good candidate, and you called back.
He's nervous.
He's nervous, so.
Yeah, he was nervous. He's a great candidate. They're all great candidates. The mobile doesn't have nitrous or laughing gas on it, so we're kind of limited behavior-wise for some of the students. Some students have never been to the dentist, even in 2nd and 3rd grade, and you'll see it's big. It can be loud once we have the compressors and the vacuums fired up. So it's a little like
Intimidating.
variant, yes. But the nice thing is you're there with somebody you know, so you also have that factor of, you know, they're gonna rat on me if I do something, you know? Someone's watching you, so, oh, you cried, you know, so. We did have one school where we extracted quite a few teeth and the word got out, and then we had some compliance issues in the afternoon when they all walk in with extracted teeth, so, but, yeah,
Thank you.
of course.
Well, I think we're all looking forward to walking through the unit and
Sure.
seeing the great work that you're doing, and we appreciate you bringing it down here today, and appreciate the presentation and the information. You're a group that we have supported through community development grants and community betterment grants in the past, so I think it's always good for us to see firsthand how that's making a difference in people's lives. So we appreciate the work you do and the mission you're fulfilling in our community.
Thank you. The mobile that's in most of the slides is our old one, so this one is way flashier.
That's great.
Yeah.
Okay, well, let's go see it.